You know that feeling, right? That knot in your stomach when you're facing a complex system, especially when your own health or maybe the health of someone you care about is really on the line. It's like standing at the entrance of this huge bureaucratic maze, and the stakes just couldn't be higher. Today, we're taking a deep dive into exactly that kind of maze, applying for Social Security Disability Insurance, or SSDI, and Supplemental Security Income, SSI. And for you listening, we're specifically zeroing in on the process right here in Virginia. Our mission with this deep dive is to be your guide, really. We want to cut through the confusion, hand you a precise, step by step plan, and most importantly, help you understand how to sidestep those common pitfalls, the ones that can lead to costly delays or even outright denials. We're going to unpack what the Social Security Administration, the SSA, really expects, how to assemble medical evidence that actually persuades them, and what truly happens behind the scenes once you hit submit. So let's unpack this. But before you even think about forms or deadlines, our sources really stress that a fundamental first step is to grasp the difference between SSDI and SSI. What are these two main programs, and why is understanding that distinction just so crucial for anyone looking to apply?
Right. It's fascinating, actually, because while they're both disability programs run by the SSA, their foundations are, well, quite different. Think of it like this. SSDI, the Social Security Disability Insurance. It's basically an insurance program. It's built on your work history, the FICA taxes you've paid into the system over the years. So if you've worked long enough and recently enough and paid those taxes, SSDI is generally your primary path. And your benefit amount, that's directly tied to your earnings record, what you paid in, essentially. Now, SSI, or Supplemental Security Income, that's completely different. It's a need-based program. It's for people with very limited income and few resources, and it doesn't matter if they have a long work history or not. The medical rules for proving disability, they're exactly the same as SSDI. But for SSI, it's the financial eligibility that's the main gateway. And this brings up something important. Many people actually file what's called a concurrent claim. That means they apply for both SSDI and SSI at the same time. This can be a really smart move, especially if you qualify for SSBI, but maybe your monthly benefit is going to be kind of low.
In that situation, SSI might be able to supplement your SSDI payment if you meet those strict SSI financial criteria. It gives you better safety net.
That makes perfect sense. Getting clear on which program or maybe programs applies to your specific situation, it really sounds like step one, like choosing the right map before you start the journey. Okay, so now our sources lay out this really clear 7-step plan. It's almost like a GPS, designed to keep you organized, on time, and aligned with what the SSA expects. This isn't just a checklist. It's more of a strategic roadmap, isn't it? Let's walk through these because they seem absolutely essential.
They really are. These steps are your roadmap to a structured and hopefully effective application. First step, map your medical story. This isn't just about dates. It's about building a narrative that directly answers the SSA's question. Why can't this person do substantial work? You need a clear condition timeline. Detail your first symptoms, the diagnosis, all the treatments, any flare-ups or hospital stays, and critically, how your ability to function changed, both at work and just, daily life at home. This consistency helps show why you can't sustain full-time work. Every piece should support that main point.
Okay, so a detailed story, not just a list of dates.
Exactly. Second, confirm your program fit SSDI, SSI, or maybe both. Like we just talked about, getting this right is foundational. It really impacts your strategy. Third, and this one is huge, gather comprehensive medical evidence. This is the proof for your story. The SSA needs this. You need notes from all your doctor's primary care specialists. Get imaging results, MRIs, CTs, X-rays, and, importantly, the radiologist's interpretation. Hospital discharge summaries, ER visit reports, lab results, any objective tests. Therapy notes, too, like PT, OT, speech therapy, pain clinic records, mental health notes, any standardized assessments. A full medication list, including dosages, changes, and any side effects your doctor noted. Oh, and if your condition fluctuates, good days, bad days, track that. Note how often the bad days happen and how severe they are. That variability itself can be disabling.
Wow, that's a lot of paperwork.
It is, but it's crucial. Fourth step, document functional limits, not just diagnoses. This is a major point where people trip up. The SSA decides cases based on what you can't do, your functional capacity, not just the name of your condition. So you need specifics. How long can you actually sit or stand? How much can you lift or carry? Can you concentrate? Stay on task? How do you handle interacting with others? Attendance. Instead of just saying, I have back pain, you need something like, I can only sit for about 20 minutes before I absolutely have to shift position, and standing more than 10 minutes causes sharp radiating pain down my leg.
Radiating pain. That specific detail sounds much more impactful than just my back hurts. Why is that kind of specific language so important?
That's a great question. It's about proficient.
Yeah.
Radiating pain or radicular pain is a medical term, meaning the pain follows a nerve path, often from compression. So saying lifting over 8 pounds triggers radicular pain down my left leg describes a specific neurological impact and functional limitation. It's more objective, less vague than just, it hurts. It helps the SSA connect the diagnosis to a real-world work limitation.
Got it. Specificity links the diagnosis to the inability to work. Okay, what's step 5?
Fifth, prepare work and education records. You need to list all the jobs you've had in the past 15 years. Include detailed duties, the physical demands lifting, standing, reaching, and the mental demands, like dealing with people or concentrating. Also list any certifications, licenses, special training, and crucially, document any attempts you made to keep working, like reduced hours or asking for accommodations that just didn't work out. It shows you tried.
Right. Shows you didn't just quit.
Exactly. Sixth, file completely, clearly, and consistently. This is where all that prep comes together. Whether you file online, by phone, or in person, answer everything thoroughly. And make sure your answers are totally consistent with your medical story. Inconsistent wording. That's a really common reason for denial. Also, be proactive. Upload or send in updated records as soon as you get them. Don't wait for the SSA to ask. And if you start online and need to stop, save it and write down that reentry code immediately. Don't lose your progress.
Okay, file carefully, consistently, and proactively. What's the last step?
Finally, number 7, track, respond, and appeal on time. Your job isn't over when you hit submit. You have to send in any new medical records promptly. You absolutely must attend any consultative exams the SSA schedules for you and meet every single deadline they give you. Write them down, put them in your phone, whatever it takes. If you get denied, and look, many initial applications are denied, you must appeal within the time frame. So many approvals happen later, at reconsideration or a hearing. Don't give up.
That sounds incredibly thorough. But even with that roadmap, it feels like there might be common stumbling blocks. You mentioned step 4, the functional limits often trips people up.
Yes, definitely. I'd say from the sources, that's a big one. People focus so much on the diagnosis, I have lupus, I have COPD, but they fail to really explain how it limits them functionally. They don't connect the dots for the SSA between the condition and the specific reasons they can't, say, stand for more than an hour, or lift 10 pounds repeatedly, or maintain concentration for a full workday. That translation is missing.
That translation piece. Yeah, I can see how that's critical. So the prep phase, building what our sources call an evidence binder, sounds like where you build that case. You said over-prepare. What does that evidence binder actually look like? What specifically goes in it?
Absolutely. Over-preparation is the name of the game here. Think of this evidence binder, whether it's physical or digital, as the meticulously organized story of your disability. It's the backbone. For medical records, you'll need notes from all your primary care visits, specialist visits, all of them, imaging results, MRI, CT, X-ray, and the official interpretations from the radiologist. That part's important. Hospital discharge summaries, any ER visit reports, lab results, objective test data like nerve conduction studies, breathing tests, things like that, therapy notes, PTOT, speech therapy, pain clinic notes. Definitely include mental health treatment records and any standardized psychological testing results, and a really detailed medication list, dosages, changes over time, and crucially, any side effects documented by your doctors. Side effects can be very disabling.
Okay, so basically every scrap of medical paper related to the condition.
Pretty much. Then for functional evidence, you need to compile things like a detailed symptom diary. Track your symptoms' daily frequency, how long they last, how severe they are. This shows patterns. Statements from third parties can be helpful too. Family, caregivers, maybe even former coworkers who saw your struggles. Their observations add perspective. Document any assistive devices you use, cane, walker, brace, and include why you need them, ideally noted by a doctor. And definitely include records of any failed work attempts or accommodations that didn't work out. That's powerful proof.
That makes sense. What about work history?
Right, for work and education data. List your job titles and give detailed descriptions of the duties for every job in the last 15 years. Be specific about physical demands, lifting, standing, walking, reaching, and also the cognitive or social demands, concentration, interacting with the public, supervision. Include any certifications, licenses, or special training you have, and get the exact dates of employment and hours worked right.
And for SSI, you mentioned finances.
Yes, especially if you're applying for SSI, or concurrently, you need a clear financial snapshot. Document all income sources, current bank balances, list your regular bills, give information on your housing situation, any vehicles you own, and any other assets that SSA counts towards their resource limits. SSI rules are very strict here. And a practical tip. As you gather all this, label everything clearly, date it, Keep it organized. It saves so much hassle later.
Okay, binder assembled, mountains of paper, carefully organized. Now, the actual filing, you've gathered everything.
Yeah.
What are the different ways to actually submit this application? And are there any, like, pro tips for that moment?
All right, you've done the hard prep work. Now filing. You've got a few options. You can do it online. The SSA's website, the Social Security Disability Benefits portal, is usually the most convenient. It has the forms, tools, everything. You can also file by phone. The main number is 1-800-772-1213. Or you can go in person to your local SSA office. They take appointments, sometimes walk-ins, and staff can help you fill out the forms there.
Okay, online, phone, in person. What about those pro tips? Little things that make a difference?
Yes, these are crucial for avoiding simple mistakes. Answer with specifics. I know we keep saying this, but it's vital. I can't work, doesn't cut it. Explain why. How often symptoms hit. How severe they are. Use those concrete functional details from your binder. Keep your language consistent. Make sure what you write on the application matches what's in your doctor's notes. Inconsistencies are red flags for the SSA. Submit updated records proactively. Don't wait for them to ask. Got new test results, a new doctor's note. Send it in right away. Keeps your file current.
Don't make them chase you for info.
Exactly. And if you file online, save your progress. If you need to take a break, hit save and immediately write down that re-entry number. Losing an application halfway through is incredibly frustrating. Oh, and one more thing. Check out the SSA's Adult Disability Checklist online. It's a really helpful guide. Make sure you've covered all the bases before you submit.
That checklist sounds useful. Okay, so you filed, sent everything off, then comes the waiting game, which can be pretty stressful. What actually happens behind the curtain after you submit? Knowing the process might help manage that anxiety.
Definitely. Understanding the stages helps you know what's going on. First, there's an intake review. The local SSA office basically checks if you've filled out the required forms, provided basic ID, described your condition, just making sure it's complete enough to move forward. Then your file goes to Disability Determination Services, or DDS. This is usually a state agency that works for the SSA. This is where the real medical review happens.
DDS, okay.
Right. DDS examiners request all your medical records directly from your doctors, hospitals, therapists, everyone you listed. Then they analyze everything. They compare your documented limitations against the SSA's very specific rules and definitions of disability. They look at whether you can do your past work, and if not, whether you can do any other type of work that exists in the economy, considering your age, education, and limitations.
Any other work? That sounds broad.
It is. Now, sometimes DDS decides your records aren't quite sufficient to make a decision. Maybe something's missing, or it's not detailed enough. In that case, they might schedule you for a consultative examination, or CE. This is an exam paid for by the SSA with a doctor they contract with.
Ah, so not your own doctor.
Correct. It's important to go to this exam if they schedule one. Be cooperative, be honest, clearly explain your limitations, your pain, fatigue, concentration issues, whatever they are. That doctor's report goes into your file and DDS uses it. After DDS gathers everything your records, maybe a CE report, they make the initial decision. If it's an approval, great. You'll get an award letter explaining benefits. If it's a denial, and again, initial denials are unfortunately common, you'll get a letter explaining why. And that letter will have instructions and a deadline for appealing, which leads back to step 7. Appeal on time if you disagree.
That process sounds involved. It also sounds like even if you do everything right, there are still ways things can go wrong. What are the biggest mistakes people make that lead to denial? And on the flip side, what kind of evidence really convinces the SSA?
That's a really important point.
Yeah.
Avoiding mistakes is half the battle. Let's talk pitfalls first. A big one is gaps in treatment. If you stop going to the doctor, DDS might assume you're feeling better. Now, if you can't get treatment, maybe cost, no transportation, specialist isn't available. You have to document that. Explain the barrier. Show you tried to find alternatives, like community clinics. Give them context.
So document the reason for the gap.
Exactly. Another is vague functional descriptions. We talked about this, but it bears repeating. My arthritis is bad isn't helpful. Morning stiffness prevents me from gripping objects effectively for the first 2 hours of the day, and I can only type for 15 minutes before joint pain requires a break. That's specific. Also, underreporting mental health symptoms. Don't minimize anxiety, depression, PTSD, focus issues, or even side effects from medication like brain fog. These can be just as disabling as physical problems. They need to be documented.
Right, mental health counts too.
Absolutely. And then the simple but critical ones. Missing deadlines. Every SSA deadline is non-negotiable. Miss one, and your claim could be closed. Calendar, reminders, whatever it takes. And finally, not appealing. Seriously, so many people get denied initially and just give up. but a huge percentage of approvals happen at the reconsideration or hearing stages. Don't abandon a potentially strong claim after the first no.
Okay, avoid those pitfalls. So what's the winning evidence? What really makes DDS or an administrative law judge say yes?
To meet the SSA standard that your condition prevents substantial gainful activity and has lasted or will last 12 months, you meet strong, persuasive evidence. Treating provider opinions are incredibly valuable. Ask your main doctors, the ones who know you best, to fill out forms or write letters detailing your specific work-related limitations. Things like how long you can sit, stand, walk in a workday, how much time you'd likely be off task due to symptoms, how many days a month you might miss work entirely if you need unscheduled breaks. Their opinion carries weight.
So getting your own doctor to weigh in specifically on work limits.
Yes. Also, objective testing. Things like MRIs, nerve conduction studies, pulmonary function tests, neuropsychological testing for cognitive issues, sleep studies, standardized mental health questionnaires. This provides measurable data that supports your reported symptoms. It gives teeth to your claims. Longitudinal consistency is powerful too. A medical record that shows the same issues, consistent treatment, appropriate referrals over months or years, that paints a picture of a persistent, ongoing condition. It hangs together.
A consistent story over time.
Right. And don't forget, side effects. Drowsiness from pain meds, nausea from chemo, cognitive fog from antidepressants. These can absolutely destroy your ability to be a reliable employee. Get your doctor to document these impacts clearly.
Wow, that's incredibly clear. Avoid the mistakes. Focus on that specific, consistent, objective evidence, especially from your own doctors. That really sharpens the focus. Our sources also tossed in some quick insights and FAQs that seem like good takeaways.
Yeah, these are good little memory joggers. For instance, sometimes visualizing helps. You could picture a Virginia Disability Application flowchart plan, gather evidence, file, BDS review, decision, appeal. Or think of an evidence pyramid. The base is your long-term treatment notes, the middle is objective diagnostics, and the peak, the most powerful part, is your treating doctor's opinion on your limitations. Maybe a mistake wheel pointing to pitfalls like vague answers, missed deadlines, treatment gaps, not appealing, or a 12-month timeline showing the typical journey, just mental shortcuts.
Those visuals help. What about common questions people have?
But so some quick FAQs. How long does the initial decision take? Typically around 3 to 6 months, but honestly, it varies a lot. Depends on how complex your case is, how quickly DDS gets your records. Sending updates promptly yourself can sometimes help.
3 to 6 months. Okay. Be patient but proactive.
Right. Should I apply for both SSDI and SSI? As we said, if you might qualify for SSDI based on work credits, but the benefit amount could be low and you meet the strict income or resource limits for SSI, then yes, filing a concurrent claim for both is often a good strategy. Explore all options.
Okay, what about affordability of treatment?
What if I miss treatment because I can't afford it? Explain the barrier cost, no insurance, transport issues, whatever it is. Show DDS you tried to find help, like free clinics or assistance programs. Documenting your efforts provides important context.
Don't just leave a gap unexplained.
Exactly. Do medication side effects matter? Yes, absolutely. Drowsiness, brain fog, GI problems, dizziness. If they impact your ability to function reliably and consistently at work, they are relevant. Ask your doctor to note them.
And the big one, what happens if I'm denied? Appeal. Appeal within the deadline, usually 60 days. So many claims that are initially denied get approved later on reconsideration or at a hearing before a judge. Don't give up if you believe you have a strong case. This has been incredibly thorough. You've really laid out the entire journey, turning what feels like this huge, scary process into, well, manageable steps. It really highlights how much preparation and persistence matter.
I think if you zoom out, the key takeaway is understanding that the SSA isn't just looking at your diagnosis name. They're evaluating your functional capacity. How does your condition, day in and day out, actually limit your ability to perform work activities? That's the core question.
Right. It's about the impact, not just the label. So what does this all mean for you listening right now? Here's our final thought to chew on. We've talked a lot about the specifics of disability applications, which seem incredibly complex. But consider this. How might truly understanding the specific functional requirements of any complex bureaucratic system, focusing on the observable impact, the what does this actually mean for doing things part, rather than just the official labels or diagnoses, fundamentally change how you approach it? Could that shift empower you to articulate your unique situation more effectively, no matter the system?